The World Economic Forum has written a comprehensive report tackling the key question of artificial intelligence in healthcare. The report, authored by Shyam Bishen, the head Center for Healthcare at the World Economic Forum, and Pratap Khedkar, CEO of ZS, deep dive into how artificial intelligence, powered by machine learning and deep learning techniques, can address the mounting challenges globally in healthcare, from shortage of frontline workers to widening health disparities. We have with us Mr. Bishen to discuss the takeaways from this report. Mr. Bishen, thank you for joining in and welcome.
Thank you for having me. It's a pleasure to be with you, Ekta.
Well, Mr. Bishen, if we could just start by you providing us a key summary of this comprehensive report.
Yes, so we worked with ZS Associates, as you mentioned, it conducted this research, so World Economic Forum research that we have done on artificial intelligence in healthcare. This has shown how artificial intelligence can be used to build adaptable, scalable solutions to systemic challenges straining global healthcare systems today. You mentioned a few of those challenges, such as global shortage of frontline healthcare workers, disparities in the health and healthcare arena, as well as the overall cost or inefficiencies in the health system. We have seen that artificial AI artificial intelligence-driven diagnosis, infectious disease intelligence, and clinical trial optimizations are among the applications where these technologies show the highest potential. We have also found that international public-private collaboration will be crucial to overcome adoption challenges and drive artificial intelligence integration in healthcare worldwide. So these are the key findings from the report.
Okay. Mr. Bishen, if you could elaborate a little bit in terms of public-private collaboration, how important is it, and how would a country such as India implement it eventually?
Yes, so the public-private collaboration is crucial here because government has a very important role to play here. The government must strengthen data privacy laws, for example, without throttling legitimate use of anonymous patient data to train algorithms. So we need access to data, we need access to patient data, but government must strengthen the privacy laws, must have proper guidelines, proper guardrails, and then provide access to this data to private sector so that the private sector can make use of the data and develop through artificial intelligence, machine learning, develop right health and healthcare solutions. So I think the partnership between the government, between public and private sector with companies is crucial here. India is on the forefront of this. India has been using AI in many areas on the diagnosis side. And I think there is an opportunity here for India to further accelerate the use of artificial intelligence and establish more public-private partnerships, not just within India, but also on the international public-private collaboration.
Okay. Can you give us more examples of successful usage of AI in healthcare? How has it helped in terms of diagnosis? How has it helped in terms of reducing costs? Any real-time examples that you can provide us?
Yes, there are several ways artificial intelligence can improve health outcomes. First, we saw that AI can improve diagnosis and risk stratification. The best way to bend the healthcare cost curve and allow people to live longer, healthier lives is to treat more people before they become sick. So that's where the diagnosis comes in the picture. AI holds vast and largely untapped promise to diagnose a range of diseases, such as cancer. And we have seen the use of AI in diagnosing breast cancer. This is absolutely critical here because as soon as we diagnose people, we can start treating them and they have a much higher likelihood of getting better soon and live a healthier life. So that's one example. The second example I would say is on improving infectious disease intelligence. We saw that COVID-19 had a profound negative effect on global health in terms of lives lost, declining mental health, strained national health system, and unprecedented healthcare worker burnout. Now that's where I believe that the AI can help in terms of finding the diseases, finding pathogens, sooner rather than later, catching them at the earlier stage, and then providing the data to private sector to develop medical countermeasures. Climate change and human migration threatens to increase the risk of future occurrence of infectious disease. So as we see more global warming, as we move more closer to the forest, to the woods, you will see more and more outbreaks, more and more infectious diseases coming out. So outbreaks will happen. How do we stop them sooner rather than later? How do we stop them from becoming a full-blown pandemic? I think that's where AI can help. It can test wastewater, it can analyze web traffic, and it can look at modeling mosquito movement, for example, and look at the pattern. And then we can deliver customized mitigation strategies. We have also seen that artificial intelligence can increase clinical trial optimization. So it's being used on the clinical trial side, but we can further accelerate that. Clinical trials are expensive, time consuming, and they are underrepresented by underserved groups and women. So AI can be used to improve the clinical trial optimization here.
So does your
Last,
report indicate that artificial intelligence powered by machine learning can replace the human aspect in healthcare?
no, I don't think it can replace the human aspect. You need healthcare, and healthcare is very is it's a softer area of of the human feelings and emotions. So I think the human touch has to be there. What AI can do is what artificial intelligence can do is supplement that and can take over some of the administrative and other tasks such as analyzing data and other things, putting data into the system, coming up with recommendations. But the human touch, the doctors, the nurses, they would still be required. We can cut down the administrative and other tasks for the healthcare workers.
Okay.
As I said, identify the infectious diseases and diagnosis and all that. But I don't believe that AI can replace human touch that's needed for healthcare.
Okay. All right. Can it reduce costs significantly?
Absolutely. So that's one area we are looking at. I think it's very clear that there are three areas where artificial intelligence can help. One is system. So it can reduce cost. It can also increase the access. So it can increase access to products and services. And it can also improve outcome as we just discussed. So those are the three areas we are looking at. Cost is very important. And you rightly pointed out, we would be looking at AI, how to reduce overall healthcare system cost.
Okay. Just quickly before we wrap up, Mr. Bishen, I wanted your thoughts about the key challenges, because one of the interesting things that you've pointed out in your report is that artificial intelligence in healthcare more closely resembles autonomous vehicles, not so much GPS. So that pretty much explains the complexities when it comes to AI and healthcare, and that there are many, many pilots when it comes to this particular space. Explain to us what the key challenges are.
Yeah, there are many challenges here, Ekta, but I would like to point out three key challenges. There are at least three common barriers. One is the insufficient high quality data. So the access to high quality, trustworthy health data is very important, but we don't have that. So we don't have full access to that data. So that's the first barrier. The second one is low doctor trust of AI solutions. So many healthcare workers still don't trust artificial intelligence solutions. And that's coming from overemphasis on flashy pilots at the expense of easily scalable solutions. And then the third one is inadequate technological infrastructure, especially in low and middle income countries, especially in rural areas where you don't have access to uh, internet, you don't have access to Wi-Fi, and you don't even have access to, in many cases, devices. So inadequate technological infrastructure. Those are the three areas that we have highlighted in the report. How do we fix for these? As I mentioned earlier, the governments must strengthen data privacy laws, make sure that we can make use of anonymous patient data, and we can use that to train algorithms. They must also help codify data ownership and secure policies to encourage interoperability of data. we see that data is very diverse. It's in many different locations, in different formats. How do we make those things easily accessible? How do we solve for interoperability? That's a key challenge. And then we want to make sure that we use these algorithms and we use these artificial intelligence responsibly and in a transparent manner. So I think
Okay.
those are the things we need to focus on.
All right, Mr. Bishen, we're going to leave it on that note. It's always a pleasure. Thank you very much for joining in and giving us your perspective of AI in healthcare.
Thank you so much, Ekta. Thanks for having me. It's a pleasure.